In Kane County, the health department has a new campaign aimed at raising awareness about the opioid crisis and epidemic. In 2022, there were an estimated 14.5 opioid-related deaths for every 100,000 people in Kane County. Fentanyl was a factor in 73% of those deaths. The new campaign is called Your Story Matters and shares experiences of those affected. Here's just one story of a couple who lost their son.
We knew a little bit about substance use disorders, but in May of 2016, we got a phone call that my son Randy had been found dead of an overdose. Turned out to be from fentanyl.
So he hid it, and he had told his brother he could handle it because he never injected, he was snorting it, and that way he could control it, he could just stop anytime. And he held a job until the day he died.
Oh, those stories are heartbreaking. Joining us now to talk more about this campaign is Michael Isaacson, Executive Director of the Kane County Health Department. Thanks so much for being with us this morning.
Good morning. Thank you for speaking with me.
So this is the first year for the Your Story Matters campaign. Why did the health department decide to launch the initiative?
Sure. We are seeing a decrease in overdoses finally after a sharp increase with the pandemic. But there's way too many families in our communities that are still suffering. And this is just an outward push to get more information out to people to support the efforts that we already have in place to get naloxone into the hands of people so that they can potentially save a life, and to connect people who may be using drugs with resources that they can use to hopefully get into treatment.
What overall, you talk about information, but what's the overall message you also want to get across as well?
Absolutely. So we're using the tagline, Your Story Matters. And what we mean by that is that every person has a different story, but there's others who have experienced similar things. We have really three key audiences for this campaign. Number one, it's people who may be struggling with substance use themselves. This is a very challenging thing. There's a lot of reasons why people use drugs. So we want to let people know that there are people out there who care for them and there's resources to help. The second audience that we really want to focus on is family and friends who may have a loved one who is struggling with substance use. If you have somebody that you care about that's struggling, that can be scary, that can be frustrating, and there's a lot of support out there that we want to connect people with. And the third and final audience is really our responders. Frequently, we have people in law enforcement or in emergency departments that they only see people at their worst, and they don't get the opportunity. And actually, one of our emergency room physicians who's in one of our videos talks about they don't get to see people thriving. So they may see the same person overdose multiple times, and that can be frustrating and feel like you're just trying to do something that's not being successful. But in fact, every time we save a life, we're giving somebody an opportunity to really find a way to recovery and become much more happy with what they're doing.
So try to keep compassion intact as well in all of these phases, yeah?
And I always say compassion is not only a kind thing to do to your neighbors, but actually it's effective. We find with a lot of people who are in recovery, it's always surprising that one person who showed compassion, who showed that they cared, that may have made the difference that actually gets somebody on the road to recovery.
Outside of compassion, what has the response been like so far? Do you feel like this campaign is effective?
Yes, absolutely. So this is, like I said, just the public-facing side of this. We also have a lot of more intentional efforts going on with law enforcement, working with our hospital partners, working with our providers. And then we're also doing a lot of work around housing and job training because, as mentioned before, there's a lot of reasons why people may use drugs. And in some cases, it's self-medicating. As we saw across the country with the pandemic, a lot of extra stresses were placed on people. So more people started using drugs. So we want to make sure that we're providing all the resources people need so that they can be as healthy as possible.
Now, I know you mentioned the 2022 numbers we talked about were definitely alarming, but you mentioned so far this year a lot of numbers data-wise in terms of overdoses, you know, people going to hospitals, et cetera. They are going down for the first time in several years. Why do you think that is? I think I heard you mention naloxone, you know, obviously getting the message out there that there is something that can counter overdoses. But why do you think progress is being made?
I think there's a lot of reasons, and there's not one key thing that's going to solve this issue. It actually takes all of us working together. Naloxone is a life-saving medication that can be used if somebody's overdosing. So we are happy to see that out in the community. But we're also seeing better linkages to treatment. We're seeing more people who have awareness so that they may be using harm reduction strategies. Fentanyl is one of the leading causes, as you showed in your statistic, for fatal overdoses. So we use harm reduction strategies such as providing fentanyl test strips so people can see what may be in their drugs, because it's not uncommon for somebody to overdose using something that they didn't know had fentanyl in it. And in the past, this was frequently fentanyl was found in heroin. Now we're seeing more and more that fentanyl is showing up in cocaine and in pills and other things. So that one time is all it takes for somebody to lose their life. So we really want people to be educated. And at overdoseinfo.org, there's a lot of information people can use. There's a lot of fantastic resources in the Chicagoland area to support people who may be struggling or family members who may be trying to help someone.
Great information and an important campaign, because this continues to, of course, be an ongoing issue that really needs attention. So Michael Isaacson, Executive Director of the Kane County Health Department, thanks again for sharing all of this information with us this morning. And you can learn more about the campaign by visiting overdoseinfo.org. Thanks again.